talk about the governor's orders that were implemented or signed today. The governor basically started opening up the economy across the state in areas that had COVID hospitalizations at 15% or less than their total hospitalization capacity. We are in a region that includes Hudspeth County and some others, and our region showed that we were at 8.7% hospitalization rate for COVID. We are actually in El Paso alone, for your edification, at 9.66% as of today. So we're still well below that 15% peak, but it's a regional peak that we're going, or regional area that we're going by. The governor said that facilities can open up to 75% capacity effective September the 21st of this year and next week, a week from on Monday. And that is, those that can operate at 75% now are gyms and exercise facilities, manufacturers, museums and libraries, office-based employers, restaurants, and retailers. There's no changes to operating capacity for all the other areas that have already been included under his prior orders related to sports and video games and wedding receptions, etc. The city's order will be amended to reflect this change, and Judge Samaniego will talk about the county, but our emergency orders have been in total sync and parallel. One other thing that the governor did was he opened nursing home visitations effective September the 24th. And the way it's determined is that a resident can designate 2 essential family caregivers for a visit of 1 at a time. And that includes nursing homes, assisted living, immediate care, home and community-based, and inpatient hospice. That's the primary overview of his orders today. We will all three each reiterate the fact that we're here to be opened, and our economy is critical to reopen, and in our case, as I've said, we're going to have to rebuild, is maintaining wearing the face masks, face coverings, the social distancing, and the washing of hands. That's how we've arrived at this place. We don't have an end to this pandemic until a vaccine is discovered, but we can stop the spread with just the face coverings and washing your hands and maintaining your distancing. So that's the quick overview of the order. We'll be dealing with some of those things. You may be wanting to ask questions. Well, are our museums and libraries going to open, et cetera? We will analyze that from the city standpoint based on our staffing levels and our financial situation as to whether or not we have the funds to allow that to open and operate. I hope we do, but that's still under analysis, and we'll make that determination as soon as we can. But our orders will be amended. With that, I'm going to pass it on to Dr. OCARANZA, or excuse me, I'm going to pass it on to Judge Samaniego, and then to Dr. OCARANZA.
Thank you, Mayor Margo, and thank you. Good afternoon. I'd like to emphasize that there's a tendency when we say go to 50 to 75, that there's a tendency to believe that it's opening the economy in a different way. I just want to emphasize that the minimum standards, more than ever, should be emphasized at this point in time. And so you move from 50 to 75 does not mean anything else, but that you follow the protocol as established in the order, the social distance, the washing of the hands, and so forth. So I just want to make sure that there's not a misunderstanding that 75 means anything different other than you have more capacity, more opportunities. So that's really very important. Restaurants that have converted or bars that have converted to restaurants That's also very important that the protocol and the minimum standards are followed strictly so that we can continue to move forward. The nursing homes, I want to make sure that everyone realizes that there's special criteria for each individual nursing home and long-term facility. So we encourage that you call where your loved ones are at to make sure what their protocol is going to be and make sure that they don't have different protocols for you. So it's not a standard. Each one has their own criteria, and each one has certain, they have to have minimums or are not having any COVID crisis in their facilities. So just please, it's not a broad brush kind of situation with them as well. There's still no restrictions for hair salons and massages, tattoo parlors, or other personal care beauty services, but that also does not mean that you don't follow strict protocol, especially in social distances. If there's an appointment, it's always better to keep the lobby open and so forth. We also want to make sure that people continue to wear their mask, do everything that's possible. I think the biggest message that the mayor and I can send at this time is that we really need to do the right thing in our community, that it's on us now. I think the mayor, the governor was very clear in saying it's now on us as a community. He's allowing us a little broader, but that doesn't mean that you sort of move in a direction simply because there is an opportunity. And I make reference to going from 50 to 75. It's very important that if you're not able to at this time, or you think it's better, more prudent to wait, then I would say that's the right direction to go and make that determination. There's also a tremendous amount of emphasis on 65 and older. So if you look at the fact that we still have the 10-person rule, whether at a household or outside or in any venue, that there was a very encouraging words from the governor saying, don't place yourself in a vulnerable situation. So if you look at the complete order, we still have a very vulnerable population here in El Paso. And so regardless of the situation or the changes that have taken place, we still have to be very careful as to how we interact if they're 65 or older and encourage people to stay home. So it's almost like a stay-home order for 65 and older, and then it's opening up a little bit. I would suggest that if we do the right thing, and the mayor and I have really emphasized this, if we go prudently forward, we're going to stay at that level. If our numbers increase because we do not obey the orders, we don't adhere to them, then it puts the mayor and myself in a situation that we have to request that we move back. For example, 15% of the hospitals, we move into 17 or 18%, that places us in that situation to feel that we need an order to go back into some of these areas that have been opened up for us. So we ask you once again, and it's very important, it's on us, community. It really is on us as to whether or not we continue going in this direction. We need to coexist, but we need to do it in a way that's very prudent. And I hope, and I know we have that great community that's able to do that. The mayor and I are very supportive to each other, trying to get these things moving forward. But if the community doesn't respond, then it's really difficult for us to continue supporting the opening of the economy. Thank you.
Dr. OCARANZA.
Thank you very much, and good afternoon. We're going to give a brief update on how we're doing with the COVID-19 here in El Paso. As we can navigate through our dashboard that we have here on the screen, we go to the left side where we see the active cases and recoveries. We continue to see patients recovering for COVID-19, and although the vast majority of the patients recover, there's still, as Judge Samaniego said and Mayor MARGO, we need to protect our loved ones that are considered to be at high risk, and those are the ones that may end up in the hospital. And that's where the governor also puts a lot of emphasis in the number of hospitalizations. We need to care for our healthcare resources that we have in our community, which are not in abundance, but we need to make sure that there's enough space so we can take care of our loved ones that are going to be needing that higher level of care. If we go to the infection rate section, we can see that the number of new cases per 100,000 are still plateauing, and we're currently at 10.2. And one of the biggest factors that we have seen that made the big difference in the way that we can control the spread of the virus was the wear of the mask. The wearing of the mask, once Mayor Margo and Judge Samaniego mandated for everybody greater than 2 years of age to be wearing the mask, that's when we saw that it was peaked after 14 days and started seeing a consistent decline in the number of new cases. The same we saw in the number of hospitalizations and deaths consequently. And the infection rate continued to drop here in the bottom part of the dashboard. And if we go now to the testing, there is plenty of testing that is still available for everybody that needs to be tested. Those that feel that were exposed, those that went out of town for Labor Day, once they return home, please go get tested, make sure that they go back to work in a safe manner, that they're going to be protecting the co-workers, their family members that are living here, and most importantly, our children that are going to be back to school for in-person instruction are going to be also safe. The schools are working very hard in improving their safety plans, so our children, teachers, and staff are going to be safe going back to school for in-person instruction. Our positivity rate also continues to drop, and we see that in our graph here, the cumulative positivity rate is still on the 8.25, and we have a little uptick on the demand of the testing, which is great. We want to find every single person that has COVID-19, whether it's symptomatic or asymptomatic, and here in our community we have about 1 out of 4 people that are positive do not show any symptoms. If we go now to the investigations side, we see that we're completing most of the investigations pretty quickly, and we try to notify those positive cases as soon as we know the result. Those that go and get tested are the private facilities or private providers. Sometimes it might take some time before they notify us, but if you get a notification of a positive result because of your primary care provider, please remain in isolation and quarantine and wait for further instructions from the Department of Public Health. Our mortality rate still plateauing around a little bit higher than 2%. And we know that most of this mortality, most of the people that pass away from COVID are going to be having pre-existing conditions in which hypertension and diabetes are some of the most common ones. We need to make sure that those people that have those conditions have enough medication. They go and get medical care if they become sick. So it is important that they seek medical attention and don't stay home for the fear that they're going to be getting infected, whether at their physicians or at the hospital. On the other section, which is the hospitalizations, we see how it has plateaued on the hospitalizations, but we're going to continue keeping a close eye on the hospitalizations because we know that right after we see an uptake on the positive cases, we're going to see an increase in the hospitalizations, and we need to keep those hospitalizations stable below 15% as mentioned by the governor and Mayor Margo. We don't want to go backwards. We want to continue having the economy with our new norm, but most importantly, the only way that we're going to be able to do it is by caring for each other. If we all wear our mask, if we all stay home when we feel sick and don't expose other co-workers and other loved ones when we start becoming sick, that's the best way that we're going to be keeping our community safe, and we'll go through this winter season in a healthier way. Unfortunately, with more of the holidays coming soon, we're going to continue with our same message as far as staying distant from each other, but closer by virtual means. Thanksgiving should be coming pretty soon, and we recently saw the Labor Day and 16th of September Paso. We're looking at the numbers and see how those holidays are affecting the spread of the virus in our community. And with that, we hand it over to Mayor Margo again. Thank you.
One of the questions you may have is do we have the Labor Day numbers in? And the answer is not completely. Today is the 10th day from Labor Day. We're still looking at them. quite candidly, we're kind of surprised we haven't seen a spike of any significance yet, but I'm hoping, I'm knocking on wood, that we'll be okay. But the key is, as Judge Samaniego said, we're going to control our own destiny from an economic standpoint going forth with the opening that the governor is allowing. So we're just, we're optimistic. People are asking about Halloween. We haven't made a decision yet from a public health standpoint as to what to do on Halloween yet. We have some ideas, but we'll announce what we recommend as we get closer to the holiday and have a better understanding of where we are on the numbers. We'll open it up to questions.
Mayor Margo, there are some questions from media on virtual. The first question that we have is, after the governor's announcement, what will that mean locally for our museums and zoos as far as opening? You referenced it. If you can just elaborate again on what this means for our local component.
Personally, I want to open our museums and libraries, but we must look at it from the standpoint of our staffing capabilities as well as our financial resources, given what the pandemic has done for us, or done to our financial numbers. So we will analyze what we can do, and as soon as we can get them open, we're going to get them open.
The second question, the follow-up question is, do you all feel safe with our reopening plans and how we're progressing here in El Paso?
I think from the standpoint of where our numbers are, our hospitalization rates, I think Judge and I are reasonably comfortable, but we're going to rely on the expertise of Dr. OCARANZA to help guide whatever decisions we're going to make. Dr. OCARANZA, you want to comment?
Yes, and we're giving appropriate advice to Mayor Margo, Judge Samaniego, in the way that we're going to be cautiously moving forward and opening in a way that is going to be safe and effective way to continue stimulating our economy, but having public health in mind. We cannot do more without the participation of everybody in the community, and instead of looking at individual benefit, we need to look in a way that we're going to have the community-wide benefit, and as such, we need to make that effort.
Judge, would you like to?
Yes, I think, as I mentioned, if we follow the protocol, we feel safe. I had the opportunity to meet this morning with Dr. OCARANZA and members of the task force, and it was very clear that they're saying is that if we follow the strategic plan, we have a lot of recommendations, but now we have to, execute those recommendations, and that's been very helpful, and that gives the mayor and I a comfort level that we have professionals that are guiding us towards where we're headed, not just simply the order, but a strategic plan on those recommendations.
Media is also asking online, are we better prepared to reopen for business now than we were back in May?
Well, my position would be I would hope so, because we opened up, and I think as I think the judge alluded to, everybody thought it was spring break and we could just kind of open up, and the health protocols weren't adhered to, and that affected what happened, and we were unable to continue. So the key is what Judge Samaniego and Dr. OCARANZA have said is you've got to wear your face coverings, you've got to maintain the distancing, you've got to avoid large gatherings, and you've got to wash your hands frequently.
Well, the governor said that we're here because of the way we've responded. And I think as a community, I see much more. We've had accolades about wearing the mask compared to other cities, so we thank the community. And so I do feel we're in a much better place, especially, I believe, I give a lot of credit to the task force getting us to a better place, a better understanding. The cooperation from especially grocery stores, how they've cooperated and what they've done to make them open, but all these rules about aisles and one ways at the aisles, and so our community has responded very well, so I do think that we're in a much better place than in May.
But one other thing to keep in mind is, and we're going to encourage everyone to get a flu shot. And that is because our normal flu season, which is from, October to January approximately, or February?
March.
March, could be as late as March. Our intensive care units, hospitalizations increased significantly just under a normal flu season. So it is imperative, given with COVID, given the pandemic, that everyone get their flu shot to minimize or mitigate or keep you out of the hospital for regular flu when we're going to need space for COVID. And if the hospitalizations increase above this 15% level, then we will have to take other action. The governor will take other action that we will have to comply with, which will be more restrictive, as Judge Samaniego talked about.
And definitely this is something extremely important, and not only to control the influenza, but many other respiratory viruses are going to be able to control them by the 3 simple steps that we have been recommending for COVID-19: wearing our mask, social distancing, and the hygiene that we need to observe. The flu shot is extremely important, and that's one of the better tools that we have to control complications from influenza, which has very similar symptoms as what we have with COVID-19. So for those that are considered to be at risk, older than 65 years of age, people with chronic conditions, pregnant women, and influenza also affects younger children, our infants, please give them the flu shot. The effectiveness of the flu shot has been in question in many years before, but there's no other time that is more important for people to have their flu shot than right now, because we want to control all these respiratory viruses, and we don't want to have our hospitals, our healthcare system being overwhelmed with influenza, with COVID-19 or other respiratory viruses. So please talk to your primary care provider, discuss any questions that you may have. Your healthcare provider might be able to dissipate some of those myths, like every time I get the flu shot, I get sick. We know that the flu shot doesn't get you sick. Sometimes you might experience some reaction in the body, but it's going to protect you against influenza. Many people don't understand that the flu and the cold are two totally different etiologies or viruses that can cause that. But the influenza is one of those that can send you to the hospital, and people pass away every year from influenza. And if in any way we can prevent that by receiving your flu shot, please do so.
Sí, lo puede decir en español.
¿En español? Y ahora en español, queremos darle la importancia que tiene particularmente en este año el que reciban su vacuna contra la influenza. El influenza, al igual que otros virus respiratorios, comparten los mismos síntomas que el COVID-19, y muchas de las actividades preventivas que hemos recomendado hasta el momento, como son el ponerse su cubrebocas, el observar la sana distancia y las medidas de higiene que ya hemos recomendado de lavarse las manos frecuentemente y no tocarse la cara, nos van a ayudar a prevenir muchas de estas infecciones respiratorias. Pero mucho de lo que tenemos y una de las armas que tenemos contra la influenza es la vacuna. Queremos exhortar a toda la población de que se ponga su vacuna. Niños o bebés de 6 meses en adelante necesitan recibir su vacuna de la influenza. Si tenemos bebés o menores de 6 meses, al todo mundo vacunarse en la casa, vamos a estar protegiendo a aquel menor de edad que puede estar expuesto ya sea por los padres o algún otro de los familiares. Es extremadamente importante disipar todos esos mitos que hay con respecto a la vacuna de la influenza, como es el que la gente piensa que se va a enfermar después de que reciben la vacuna de la influenza, y no es así. Sin embargo, muchas personas pueden reaccionar a la vacuna, pero afortunadamente cuando reciben la vacuna están protegiéndose contra las complicaciones de la influenza. Otra de las cosas que es importante mencionar es de que la influenza y la gripa común no son iguales y son causadas por virus diferentes, y mucha gente puede decir que a pesar de que recibió la vacuna de la influenza, de todas maneras se enfermó de la gripa, pero la gripa y el flu no son lo mismo, y vamos a estar previniendo el flu, y a la misma manera vamos a prevenir que nuestros seres queridos acaben en el hospital o sufran de complicaciones debidas ya sea a la influenza o al COVID-19. Entonces, exhortamos a toda la comunidad que vaya, reciba su vacuna de la influenza. Vamos a estar teniendo una campaña intensiva con la vacuna de la influenza, así que esté sintonizando. Y si puede recibir su vacuna de la influenza con su médico primario en su clínica, por favor hágalo.
Last question from the virtual world. Schools are starting to reopen for in-person instruction. We recently had the Labor Day holiday, and others are forthcoming, as is the flu season. Do you all have any concerns with the latest reopenings aligning with events like these, where there could be increased potential for spread?
I'll let Dr. OCARANZA expand, but the bottom line is, yes, we have concerns. We have the same concerns we've had from day one. You've got to wear your face mask, you've got to wash your hands, and you've got to maintain social distancing. Nothing changes on that. The fact that the governor is opening our economy more so as a result of the hospitalization rates on COVID and what the state has been looking like in reductions or stability, I should say, more than reductions. It gives us a start to improve our economy to some extent, at least as a beginning, if we don't, if we adhere to these protocols. Dr. OCARANZA.
Yes, as Mayor MARGO said, we have concerns for children and teachers and staff going back to school. School districts, either public or private, employ thousands of people here in El Paso, and we're going to see a big movement of minors or also the teachers and the staff. But nonetheless, the school officials have been working very hard in improving their safety plans. We are working very closely with the school officials so we can provide guidance, so we can bring our students back to school for in-person instruction in a safe way. And we want to mention to the community that the risk is not going to reduce to zero. There might be a risk, but we need to minimize the risk so we can provide the benefits of in-person instruction to those minors. And especially the younger the children they are, the more benefits they're going to have for coming back to school for in-person instruction. Every single one of you parents have experienced how hard it is to teach our children in a computer in a virtual way. So we need to let our professionals, our teachers, take care of our children and instruct them for right there in the classroom in a safe way, and they're prepared, and they're going to be following all the strict health protocols that we have also provided to them.
Thank you, Dr. O. We now open it up to the media that is here present. I will ask the speakers to please repeat the media's question so that the folks who are joining us virtually can hear the question. Thank you.
Is there an industry impacted by this governor's order that concerns the gentleman the most as we do consider to implement them in the next week?
The question is there an industry that's impacted by the governor's orders that causes concern for us? I don't know that it causes any more concern than anything else. I think the biggest thing is that our restaurant industry, which is significant here, can basically operate at what amounts to almost full capacity, which is a positive. I encourage people to be safe if they're comfortable, take advantage of our local businesses, go out. The retail can now open up to full manufacturers, office buildings. Offices can open up to capacity. So it's a positive as a start to try to begin the reopening and ultimately the rebuilding of our economy locally. So I think it's positive. I don't know, Judge, do you have anything to add to that?
Yeah, the one that's very heartfelt, because I've been working with them, is the Hotel and Motel Association.
Right.
That has been a real difficult, challenge for them. They've had sometimes two occupants in their hotels, and they're working very hard. And I think the community, when we talked about the community coming together and that it's on us, part of it is, to be sensitive to that, maybe stay over on a weekend or do something to help the industry, like we said about the restaurant. If we do it right, we're helping restaurants, we're helping employees have a job and so forth. So I think as a community, if we come together and recognize what are some of the areas that are going to make us vulnerable leaving COVID one day, I think the Hotel Motel Association is one of them, where they're working very hard, trying to be very creative, but that's been a challenge that I see that stands out for me.
Siempre puede haber esa posibilidad y la
¿Sí
pregunta
puede
es...
dar la pregunta?
Repeat the question.
Ya, la pregunta es de que si hay la posibilidad de que aumente los contagios ahora que se han abierto un poco más los negocios. Y la respuesta es de que sí, siempre puede haber esa posibilidad de que haya un aumento en los contagios, como lo vemos cuando hay algún día festivo, un día feriado, pero tenemos que estimular la economía, tenemos que ayudarnos unos a otros. Tenemos que ayudar a esos dueños de los negocios, pero teniendo en cuenta nuestra salud, y hay maneras de que podemos hacerlo. Seguimos recomendando que si no necesita ir al restaurante, vaya, compre su comida al restaurante y se la lleve a la casa para que la disfrute de una mejor manera. Y así como esas, hay muchas maneras en las que podemos seguir estimulando la economía local y protegiéndonos unos a otros. Do you need me to do it in English or?
Yes, if you can repeat the question and...
The question was about if there's a possibility that there's going to be an increase in infections once the economy is going to be reopening. So the answer is that there's always going to be the possibility once we reopen the economy that there's going to be an increase in the infection rate. But there are ways that we can continue stimulating our economy, keeping our health in mind, and there's ways like takeout. If you feel like having a dinner and just go pick it up at the restaurant, you're going to be stimulating our local businesses and you can bring it home. In such a way, there's many other examples that we can have in which we keep our health in mind.
From my standpoint, yes. I'm in favor of opening the economy as the governor has stipulated today to cover your question. I mean, we've talked about this unequal balancing act between our health and our public health, our physical health and our financial health. And then we have this bridge that we are affected by as our mental health on both sides. And so I think it's imperative, if we have some positives, it's imperative that we start trying to open up our economy. It is too critical for us not to. However, the caveats continue to be, you got to wear your face covering, you got to maintain social distancing, you got to avoid large gatherings, and you got to wash your hands. So that's the key. And 90% of the epidemiologists across the world say, while we may not be able to stop the virus per se until we have a vaccine, we can stop the spread by those health protocols. So, Judge, Dr. OCARANZA?
Well, I would just like to reiterate that it's very, very important. One of the things that we've learned, it's not the opening of the economy that's the risk. When you go to 50 to 75, that means that you're able to handle 50. And then if you do it properly, and you take your time and you're prudent, then you handle 75 in the same way. As I said earlier, the problem is that the impression is we're going to 75, that means that we can relax. And as long as you maintain the minimum standards of everything you did at 50, and wearing the mask and doing everything in the spacing and taking it upon yourself, that they tell me a lot that a bar X did X or whatever. It's also us not entertaining those situations. And so once again, it's not the opening of the economy, it's how we take advantage of that opportunity.
And as far as the health perspective, we're in a better position now than what we were in July, and we're cautiously optimistic, and we thank our community for coming together and following those recommendations. And if we continue following the same recommendations as mentioned by Mayor MARGO, Judge SAMANIEGO, we will continue to move forward as a community because we're not fragmented. We all need to stay together. We all need to work in all these different collaborations between the economy, between the public health, between the many aspects of what our community is. And that's a way that we will continue moving forward in a positive way.
Just a quick example of how it slips a little bit. You go to a restaurant, you take off your mask, then you don't realize, and you walk to the bathroom, and nobody realizes that that's not what we're wanting. As soon as you get up, you wear the mask, but we're still not conditioned. And you see that quite often. They wear the mask, sit at the table, everything's perfect, but then they walk to the bathroom and they take their mask, they've left their mask off. So it's those little nuances that we're failing to do. Once we take care of those nuances, I think we're going to do very well.
Dr. Carranza, more schools are sending students to the classroom. Have you seen any trends when it comes to the infections in children and the way that they spread the virus?
The question was if we have seen a trend now that the children are coming back to school and if we have seen an increase in infections, right? Well, the answer is not yet, even though there's some of the schools, especially private schools, that started in-person instruction. We haven't seen a trend, but we're working closely with the schools so we can keep an eye on the trends. We're looking at the absenteeism, how the influenza-like illness is developing the school system, and if everything that comes in scientific papers saying that the infection between children, the younger they are, the less frequent it happens. We're going to see if that holds true or not. We know that the older teenagers are going to be transmitted the virus the same as adults, and that has been published in many scientific journals. But we are also waiting to see how the children that are going to be back to school, either younger or older. First, we need to teach them to wear their masks. Second, when the teachers are going to be doing a wonderful job teaching them to wash their hands often, and with the safety protocols in place that the schools have been designing, then we think that that's going to be the formula for successful and continue in-person instruction at schools.
Doctor, la pregunta en español, por favor, es lo que andan requiriendo en el Internet.
La pregunta era de que si esperamos ver un incremento en la tasa de infección ahora que los niños están regresando a la escuela, y la respuesta es de que sí esperamos ver que pueda haber un poco de infección en estos niños, aunque en muchas de las revistas médicas se menciona que los niños, mientras más chicos, no transmiten la infección a la misma velocidad y de la misma intensidad que los adultos o los adolescentes ya mayores. Por lo tanto, si enseñamos a nuestros niños de que se tienen que dejar el cubrebocas, los maestros y los padres tienen que enseñarlo a nuestros hijos que tienen que seguirse lavando las manos frecuentemente, y siguiendo los protocolos de control de infecciones que han elaborado todas las escuelas, creemos que esa va a ser la fórmula para tener éxito en el seguir la instrucción en persona o de manera presencial en las escuelas, y es como vamos a ver si ha habido un aumento en la transmisión del virus o no. Vamos a seguir trabajando muy de cerca con las escuelas para ver y monitorear sobre todo las ausencias debido a infecciones respiratorias y la tasa de infecciones respiratorias que se manifiestan en la comunidad pediátrica o en los niños.
Well, I haven't been, we're just going to have to relook, the city management is going to have to look at it from a staffing standpoint and visit with the folks in charge of that. I don't have a definitive answer until we look at it. We weren't sure, we didn't know what the governor was going to do till he announced it today. I'd had an inkling, and I was guessing this might be it. But again, I want to remind all your viewers that this is the 10th day from Labor Day. And it's usually 10 to 14 days that you get the results of a holiday and the spikes. So we're not yet totally out of the woods so to speak, on this. So we want to look at that. But as I've stated earlier, the city, and I'm sure the county that would feel the same way on anything that they haven't opened up, if we can open it up properly with staffing and have the financial resources to continue, we will. It's imperative. We know that. And libraries especially, and our museums. So we'll look at that and see where we are. Well, I think we're about done, aren't we?
There's one last question online, and we'll leave this as the last question. Has there been a decrease in the number of people getting tested? If so, how much? And for that question, I'm going to invite Assistant Fire Chief Jorge Rodriguez, coordinator for the OEM, to speak to that.
Good afternoon. So since we saw the downturn of the peak of cases over these last few months, but approximately we've seen about a 10 to 15% decrease going into Labor Day. Our numbers have improved as of this last week. We finished yesterday right around 2,500 tests per day, and that's going to be a good consistent number. That if you look closely to our scorecard, our goal is to hit about 1,800 tests per day. We've been doing that consistently for the last several weeks. We did see a little bit of a dip, but we'll be able to maintain that going forward. We have more capacity than we've ever had in regards to testing, plenty of capacity at the city sites, state sites, and also all the other partners that we've worked with in building this really large comprehensive testing system. So that's all available. So thank you.
Thank you, Fire Chief Rodriguez. With that, we'll conclude today's press conference. We thank everybody who joined us on the virtual world as well as here in person. We'll see you all soon. Stay safe and keep your mask on.
Thank you.
Thank you.
Thank you.
Thank you, guys. Thank you, Laura.